Hong Kong logged 5,198 new COVID infections, surpassing the 5,000 mark again after dipping below it yesterday. 564 of today's cases were imported. Meanwhile, starting Wednesday, hospital authority employees who have been identified as close contacts of a COVID patient will be allowed to return to work if they test negative with a rapid antigen test the next day. Christy Khan has more.
The hospital authority will adopt a new back-to-work arrangement for its employees in anticipation of a potential surge in demand for medical services during the winter flu season. The arrangement will allow staff members who have been identified as close contacts of a COVID patient to return to work if they test negative with a rapid antigen test the next day. For the first 6 days after being classified as a close contact, HA staff will also be required to take PCR tests. Under current regulations, HA employees can only return to work on day 6 after being classified as a close contact. It's understood that shortening the period aims to help alleviate manpower pressure in public hospitals, but the health experts said authorities should handle the matter case by case.
For those who is living within the household with family members diagnosed to have COVID, those having dinner with somebody or having lunch with somebody who ultimately or who later been diagnosed to have COVID. I would prefer these two groups of close contacts to have a more longer period of time to verifying them whether they get COVID or not.
He noted that these groups of close contacts should undergo more tests for the first 4 days before being allowed to return to work. Furthermore, he added that authorities should be more cautious if employees are working in some medical wards, such as elderly or geriatric wards, pediatric wards, or intensive care units.
As we all know that the patients stay in those what are relatively immunocompromised. So we have to make sure that all those workers, all those medical staff working in that particular area should be free from COVID infection. So if possible, why not we prefer a bit more?
He suggested that the hospital authority should consider allowing this group of staff members to undergo a 3 to 4 day monitoring period prior to returning to work. Christy Khan, TVB News.